I just think it's rude, ignorant, thoughtless.
Your risks far outweigh the benefits.
It's up to me to weigh up the circumstances that I'm prepared to risk.
I just need to have my testicles checked. When I swing over, they sort of go glump.
Oh. You're in pain, Mum.
Oh.
Doctor, can you put your thing up my bum, see if I've got a lot of poo up there?
I mean, if I was going to go, fine, but I don't want to find I'm going to spend months almost like a vegetable.
There are some risks of people having a stroke. The worst case would be that you didn't make it through.
Yeah.
Good morning, Putney Mead, how can I help?
That will be Dr. Neal, and that will be between 9 and 11 this morning.
We've got one appointment left, 8:38, that's doing well. I remember sometimes for 8:09, we've booked it all out, literally.
So, because we've got a bit longer, what I've done is sort of made a bit of a list of things to talk about. So, why don't, before we go into that, were there other things that you wanted to talk about today?
Doctor, can I ask you a question? If a woman is married to a bloke and he beats her up, like black and blue, right? And she comes and sees the doctor and he says, where'd you get that? And you said, is your husband beating you up? And if the mother, turns around and says to the doctor, yes, can the doctors do something about it?
Why did you ask that?
Can they do that, doctor? I know everything's changed now.
What makes you ask about that now?
No, it's... I wanted to ask you.
Well, of course, we could always help.
I wanted to ask you, didn't I, Richard?
Yeah, because we was
I like
that trial and retribution.
It's like...
It's always like this, Doctor. A man shouldn't hit a woman and a woman shouldn't hit a man. See, so...
No, we've never done nothing like that at home.
No.
The staff have been very good.
Yeah. Okay.
Anyway.
But you two are all right?
Yeah, fine.
Yeah.
And you said you was going to mention the doctor earlier about your bum.
Every time when I eat something, it goes right through my stomach. It gives me diarrhoea. And my bum has been very sore. I've been wiping it, but it's been very itchy.
Okay.
And when I go, I pass wind in my bum.
Yeah. What about pain in your tummy? Are you getting anything?
No.
Does your tummy get bigger, have you noticed?
No.
No, it doesn't sort of puff out.
Yeah.
Okay. And from what you've said before, it sounds like there hasn't been any blood in there or anything.
No.
No, good. Okay.
No.
Fine. Is it better when you're not going to the loo so often?
I know when I do a big poo, my bum gets very sore.
Yeah.
Oh, it's very sore.
Okay.
You have to give it a few flushes before it really, gets rid of it.
Yeah. Yeah.
You know what it's like, Doctor.
I do.
Yeah.
Oh, dear.
Hello.
Good morning.
How are you?
Not good, not good.
Oh.
I had the worst cough and cold I've ever had in my life.
Did you?
I had paroxysms of coughing every few seconds. In the end, I had to just hold my mouth shut and just cough internally. because it was tearing my lungs apart. It's a cough that comes from down here. It's not a light cough. It's really a hacking cough.
Right.
I call it my graveyard cough. You see, it's very difficult for me, and I don't really expect you to believe this, but the work I'm engaged in, there's a lot of occupational hazard.
What is it you do?
I'm working in a healing ministry, it's Christian healing ministry, and of course it overlaps a bit with what we call the deliverance ministry.
People will go off on tangents often when they're talking about their problems, and actually it's not really, not all of it is very relevant to that particular problem. Although they may think it is very relevant, it doesn't help us diagnose, we make a diagnostic decision really about what the problem is.
When you go into the enemy's territory, he doesn't like it. And the devil is extremely clever at coming in under disguise. I mean, this morning, I just suddenly felt so ill. And then I thought, oh, this is just his back to his tricks again. And I find that it's what I call an attack from the other side. It's not a genuine thing.
Right, well, with regards to your cough, I'm just wondering what the next step should be. I didn't really address it. It was one of those moments where you just think, well, that's a bit, I don't know where I'm going to go with that. Sometimes one of the medications can cause your ankles to swell,
yes,
and one of them can cause a cough, so I'm a bit reluctant to increase any unless we need to. Yeah. Now, I think the sensible thing would be to check your blood pressure again in a couple of weeks, and then we can make a decision. Yeah. Okay.
Well, thank you very much.
Good morning, Putney Mead. Rachel speaking.
My stomach's growling already. It just went... Can you get me some peanut biscuits and a packet of McCoys or something, please? Thanks. Bye. Oh, is it one of your homemade concoctions?
Well, me and my mum made it.
Oh, what's a big bit?
Come in, have a seat. Nice to see you again. Yeah, how are you?
Yeah, good. Yeah, well, yeah. I really just want to renew my medication, really, and
yeah.
But I've got a bit, I must admit, Dr. Vajo, could you help me out with something to sleep, please? Because I think I'm sort of, I know my brain would just want to let me sleep, you know what I mean?
Okay.
I was sort of becoming a bit insomniac and only getting sort of a couple of hours, you know what I mean?
Okay, why do you think you're not sleeping?
My brain just won't let me, you know what I mean? There's too much going on, like, I'm trying to close my eyes and I'm not happy, you know what I mean? No.
Anything in particular going on in it that you think might be stopping you from sleeping? Is there anything upsetting you or stressing you?
Probably, yeah.
Okay, and what do you think those things are?
I can't put a finger on it, you know what I mean?
Can we just check you over a bit? Is that all right?
Yeah, sure.
All right, okay. Just want to take your jacket off for me. Just undo that for me.
I can't. I can't.
So you're living in a tent at the moment?
Yeah.
Take a seat.
Yeah, the reason I come to see you is out of the blue, they stopped my climber valve.
Right.
Now, I knew nothing about it was stopped because I should have seen someone in March. Nobody told me I should see someone in March with this electronic stuff. How do you know?
But the pharmacist should be relaying anything that we pass on, so that it's because it's a new thing. I think there will be some hiccups. So I'm really sorry if it hasn't worked out for you.
But then I've also been attending this surgery more than any time in my life, probably, and I just think it's rude, ignorant, thoughtless to actually stop something without even telling me.
It was stopped in June.
But you see, because I only take one every other day, Dr. Andrews, I wouldn't have ordered them since then.
That's absolutely fine. But as responsible prescribers, we have to know that you've understood the risks of being on HRT at this stage in your life, and we have to document that. So, you know, your risks far outweigh the benefits at this stage when you've been on it for this long, and that's what all the research is saying and continues to say. So I think it's really just so that we can be sure that you understand that staying on it increases your risk of breast cancer, increases your cardiac risk. There are other, you know, it does carry risks with it.
But so, I think it's up to me to weigh up the circumstances that I'm prepared to risk.
It is entirely up to you, and our job is to be absolutely certain that we just keep reminding you what those risks are, because that's what our job is. So it is entirely up to you. I entirely agree with you, but that's what that's about. That's what's happened. So
Well, if I'm
I can
told,
reinstate it. Yeah. So I'm not going to put this in your Dosset box in that case.
Right.
But I'm going.
Oh, that's right.
Yeah, exactly.
Just leave it to me to order it. Excellent.
Good.
Anyway, lovely to have met you.
And you.
Dr.
I'm glad we
Andrews.
managed to sort that out this
Well, I am,
afternoon.
because I came in here absolutely. I had steam coming out of my ears. I really did. And said that I was going to sit downstairs and sing "I Will Not Be Moved" until I saw somebody.
She means it.
Hello, Patty Leeds, Lorraine speaking. How can I help?
Hi there, you okay?
My GP surgery doesn't do injections, they don't do blood tests, so actually this is an exceptional practice, to be honest.
How much do you normally drink in a day, Stephen?
3 or 4 strong cans a day, yeah. I suppose, yeah.
And any thoughts of cutting back on your alcohol or getting a bit more help with it? Or does your outreach worker help you with that?
Yeah, well, it is from a drug and alcohol organisation, yeah, sure.
Have you got your outreach worker's number?
Yeah, I have.
Can I have it?
Yeah. Yeah, his name's Charlie. Sorry, mate. No,
do you want me to do it?
Yeah, if you can.
Yeah.
Yeah, do you think you can do it? Oh, someone's right. Oh.
That's him.
Yeah. Is that Charlie?
Yeah.
Can I talk to him? All right, Charlie.
I can speak to him, actually.
Okay, no problem.
I can speak to him, actually.
Yeah, sorry, I'm with my doctor. He'd like to talk to you.
Oh, yeah, okay.
Yeah, I'm here now. Right, okay. There you go.
Hi, is that Charlie? Charlie, hi, I'm Dr. Buveja. Stephen's just turned up to see me today. I was actually just asking him to get me your number. I'm sure you might be a bit busy at the moment. Do you mind if I give you a ring maybe in the next couple of days? Is that all right?
Oh, that's fine. Yeah. Give me a call tomorrow.
Yeah. Cheers, Charlie. Bye. Bye. Is it all right if I talk to Charlie about it?
Yeah, of course. Yeah.
All right. I think today you seem a little bit like as if you might have had quite a lot to drink.
I've had a bit to drink.
Yeah?
Okay.
Will you make an appointment to see me in about a week? Is that all right?
Okay.
And maybe next time just come with a little bit less alcohol on board, if that's all right. Just so that I can understand you, really. And that we're not jumping around. Is that all right?
I know where you're coming from. Right.
Thanks very much.
All right.
Cheers.
All right.
All right.
Lady needs an urgent appointment, so I'm going to put her on now.
Doctor, just do me a favour. Can you put your finger up my bum, see if I've got a lot of poo up there?
Well, I think it'd be helpful, actually. Yeah, let's do that. Just relax, Teresa. Well done. Sorry.
Ooh.
Well done. Good.
Goodbye.
We'll talk about it in a sec. So get yourself dressed first, and then we'll have a chat
Is my
about it.
bum sore?
Doesn't look too bad, actually.
Have I got poo up there?
No, nothing that I can feel in your bottom, but it doesn't mean it isn't higher up in your tummy. So I'm just going to have a look at the computer to see if we have that X-ray of your tummy, all right?
All right, love.
Yeah, so hold on a sec. No. You do have to go to Queen Mary's for your X-ray of your tummy.
My tummy?
Because an X-ray can help us when we're wondering if there's lots of poo in your tummy.
Yeah.
I think that'll be a helpful thing, because I'm trying to get a reason why sometimes you're having these runny tummies, really.
Yeah.
Is that all right if we get that done?
All right, love.
Okay. So get them to make the appointment for the blood test and for that thing.
Oh,
Okay.
thank you, doctor.
That's the blowing test. There you go.
Oh, thank you, doctor.
And do you, what soap do you use?
Well, I use a body wash, my darling.
Because I think your soap maybe dries your skin out a bit.
If it gets bad, I'll have to come to you.
Okay.
Yeah. Sure, I like your jacket, by the way.
Thank you very much.
It's nice, isn't it?
Richard, leave Dr. Ernest's flowers alone.
Okay. All right then. I'll see you soon.
All right, doctor. See
Take
ya.
care, Richard.
Bye.
Bye-bye.
When I grow up, I will be a doctor.
Do you?
Yeah.
Oh, it's a very interesting job. You get to meet lots of lovely people. Oh, oh.
Warm this up, shall we?
Hello.
Oh, you're quite heavy. If you open up nice and wide for me and say ah. Say ah.
Hello, sweetie.
Is it a bit tickly?
Yeah.
Is that a bit tickly?
Yeah.
Come in. Hello, Mrs. Hall. Hi, come on in. Hi there. Come on in. Right. How can I help?
It's just sometimes I get palpitations and I get the odd dull pain in my arm.
Can you describe it?
Just like a dull ache, really.
Look at that helicopter.
It's like a headache feeling, but except in your arm.
And how long would it last for? Is it all there all
A few
day?
seconds.
A few seconds.
A couple of minutes.
Couple of minutes. Okay. And what are you doing normally when it comes on?
Right, can you let me talk to the doctor? I just ignore it. Just getting on with things.
Okay.
Ashley, please.
Ashley.
Ashley, right. You've been warned so many times now.
Probably you
Right,
should.
now,
maybe
come and
not
sit
touch
down here now.
Thank you. Sorry. So
I was recently diagnosed with a hiatus hernia that came up in a chest x-ray.
Mum, I think there's going to be a storm coming.
I can't concentrate. Please, can you be quiet?
Look, I think there's going to be a storm
No.
coming.
probably right.
It's not. It's going to be sunny until Saturday. Right, can you stop?
There's lots going on, isn't there? How are you managing?
It's tough, but I manage.
Managing.
I've got gallstones, as you know.
Yeah.
I've had a history of gallstones.
Right.
And I've also had a history of heartburn.
So, and what was it
indigestion.
If you've had this as the same pain for some time, what was it that made you call up today specifically about this pain?
Because I keep feeling lightheaded.
When did that start?
Just this week.
All right. Has anything else changed recently?
No. Ashley, please.
Some consultations are completely chaotic. And that can be because of the GP, the things that the GP is dealing with, or the patient's, the chaos of the patient's living. And you can literally see it playing out in front of your eyes in the room. It's quite difficult to keep focused. And I'm always worried that I would miss something. And that's often where the discomfort is for me. I actually think it might not be a bad idea to get some tests done to rule out the heart as a cause of this, okay? And actually, probably the best way to do it would be through the hospital for the cardiologists.
I'm okay, yeah.
All right, so you'll hear from them.
On there, yeah.
Blood pressure and the pumps.
Brilliant. Thank
All
you
right.
very much.
Look at me. Look at me.
So I think I do keep my cool, but I worry that I've missed something. As people walk out and as the chaos leaves, I'm always left thinking, you know, what have I just missed? There's something else there.
Hello. Is it Mr. Morris?
Yes.
Hello, I'm Dr. Ernie.
Yes, good morning. I usually see Dr. Andrews,
Yes,
a
I
good
saw
relationship, but this is a man thing.
Okay.
It's not a matter of embarrassment. It's just that
that's fine.
she doesn't have a penis and you do. I just need to have my testicles checked. They feel swollen.
Okay.
They feel heavy. So I noticed it 2 or 3 weeks ago during warm nights when I sleep naked. When I swing over, they sort of go clump.
Okay.
You know.
Yeah.
There's a slight pain at the root, as though being pulled.
2 or 3 weeks you've noticed this?
2 or 3 weeks ago, or just realising, it's a warm night, but penis, as you know, gets very floppy, but it felt more floppy than usual.
You've also written on here low libido.
Yeah, I'm just turned 75. I've not had a sexual relationship for years, so if I do masturbate, it takes some time to get anything more than a...
Really? Okay. Yeah.
I mean, I've been giving it more attention because of this. So.
Yeah, no, of course. Have a seat up on the couch.
What's your date of birth?
You're very welcome. Take down.
And the name?
Archie. Oh, I love that name, Archie. Hello. Could I have an appointment, please? I'm sorry, he probably doesn't sound anything like that. No, he doesn't. He's only born in 2003. Hello, it's Archie.
How are you getting on?
Since I last time saw you, I'm out of tablets for blood pressure.
When did you run out of tablets?
About a couple of weeks ago. I've been a bad boy for the last 2 weeks.
Yeah, well. So, and how are you feeling in yourself?
I think so. I'm feeling much better.
Are you?
I'm feeling much better.
How are the stresses? Do you remember last time you were going through a lot of stress?
Comes and goes, I think it's my nature. I can't let go things quickly. I want everything perfect in my life, especially in the business,
Okay.
So if something is off a little bit, I get very uptight.
Right.
With my staff and all that.
Okay.
And lots of my friends have said to me, Ash, you need to chill out.
I mean, we had this chat before.
Yeah.
You're putting yourself at a very high risk.
Yeah.
I'm being serious because actually we're not talking about 10, 15 years down the line. If you carry on like this with these readings, blood pressure, with that lifestyle, heart attacks and strokes are a very real possibility for you. How will your wife manage if you have a stroke?
Difficult. I've seen people with stroke, and I have an uncle had a stroke nearly 3 years now, and he's in a home care, and all his money, what he's earned, is going in, being looked after, can't move, can't talk.
Okay.
He's like a cabbage sort of thing. I've seen a friend passing away, so I think...
So you've experienced it close up.
Experience, yeah.
And so I think we need to make some changes now, and I agree, and I would support you. We talked about work stress.
Work stress is the biggest problem, and then another one factor is my dad living with me, and it's getting a bit... I know he's 89 years old, it's my responsibility to look after him, but it's just getting sometimes a bit irritating,
Okay.
Sometimes, he makes a lot of mess in the kitchen, and when I see it, I said, what is this, Dad? Come on. Things I tell him, don't do it, just leave it there. He keeps on doing it and makes a mess. And that boils me up,
I'm just wondering what might help you. What techniques could we try, or could you try, to stop yourself getting to the stage where you just boil over, suddenly going from nothing? You're not going to be able to change him.
No, there's no way I can change him,
But we might be able to focus on how you change how things affect you.
Yeah, okay.
Because I think that's where we could start.
Okay.
You can't change him, but how do we change the impact on you?
Okay, all right.
So you're in the same situation, but you approach it differently.
Okay.
I mean, there are other options. We have other options. If you're getting very stressed with this issue, we can always think about a few sessions of counselling where you can just explore this with somebody who's not related to your family, and you could really work through what options you have.
Okay.
And I think we need to do this together. So what tablets do you need today?
I need the whole, everything.
And then can you have a think over the next 2 weeks, between now and when we touch base, what else might help you to manage the stresses?
Okay.
Just have an ideal world. What would help you? What do you need to do? What do we need to focus on? We'll do the blood pressure, but what else might help you to focus on the stress?
Okay. All right.
Yeah?
Okay. All right.
Between us, I think we can then get there, because otherwise, all of the stuff I do is not going to be worth it if you're going to go off.
I understand that.
It's
not. It works both ways.
Yeah. So if we're happy to do that.
Yeah.
Putney Mead, how can I help? Do you want to go and take a seat on the first floor?
Mr. Ackerman.
Doctor, how are you?
Fine, thank you. Nice to see you.
Nice to see you.
Right. What can we do for you?
I've had an operation on my ear. He had to rebuild my eardrum.
Okay.
Completely. When I came out of hospital, it was brilliant. I was jumping up and down. I could hear with both ears. But I had an infection, and ever since then, it's been driving me insane. Doctor, I am having a hell of horrible time. And I get the most throbbing headache, the mother of all headaches, I kid you not, and it hurts. It really feels...
Is there pain in the ear?
Yeah, everywhere. I get it all over. It makes like a bubble noise. Do you know what I mean? It's driving me absolutely insane. I wish to God I'd never had the operation. I really do.
Right.
Now, the past couple of weeks, I've been losing my balance.
Right.
Nearly fell a couple of times. I'm a chef, you see. And I'll be honest with you, Dr. King, I'm very, very worried because I use twin fryers and the temperature is 190 degrees. And if I fall head first into one of them, it might as well serve me on a fish and chips as well, or whatever.
I'm just feeling for any lumps in your groin there. Okay. So I'm just going to check your penis as well as your testicles. All right. And where's this pulling discomfort that you get?
It's really at the root.
So I'll just examine your testicles, okay? Good, that's fine. Would you mind if I examined your prostate?
Yeah, what does that mean? Put your finger up my bum.
Yeah,
Yes.
that's right. Is that okay?
Yeah.
So the way to do it is roll over and face the wall.
Yeah.
And well done. Deep breath. Oh, that's it. That's fine. Why don't you pull up your trousers and come and have a seat and we'll talk it all through. Let's have a look. That was in the past. Okay. Your testicles, from my point of view, feel normal.
Right.
And your prostate felt fine.
Mhm.
Slightly enlarged, but a normal shape. And what's reassuring is
they feel normal.
They do, exactly. With testicular cancer, if it's causing a heaviness to the testicles, they do feel remarkably different actually from normal. They really feel very heavy from our point of view. So the fact that yours don't feel like that and they're a normal shape, no extra lumps, is very reassuring. In terms of the erection change and the low libido, it might be worth checking your prostate blood test, but also your testosterone, just to make sure there's no sign that either one of those is abnormal, just as a so that we're covering all the bases, really. Okay?
Yep.
All right.
Thank you very much.
Not at all. Nice to see you.
Stop me if it's sore when I'm doing this, okay?
Right.
It's still wet and red. And
Sorry?
It's still wet.
And red.
And red, and
Very red.
there's exudate covering it. We'll take a swab, but we also need to do something as well. We can't just leave it like that. Let me just touch this on the inside. Sorry if this is a little bit sore. Sorry. Sorry. Okay, all done.
Did you see a small little hole in there still, no?
I can't see the eardrum. It would be better to have you seen by the surgeon that did the operation, but it's not a complicated problem. It needs to be looked at and it needs investigation. So I think that is probably the way to go. That we can get you seen in that clinic.
Can you give me tablets for it or anything to?
We can give you some tablet antibiotics.
Yeah, that'd be nice if I can hit it with that. So I'm amoxicillin, yeah? We'll hit it with that.
We'll try.
Yeah, no worries, Doc. You
No
guys
problem.
do a great job, so, you know.
All right.
Thank you for your time.
No problem.
Lovely to meet you.
And you. Wrong way.
Wow.
That way.
Do you know what when's the skeleton then? Do you know why? I think it's the chemist. Hello. Hi, can I pick up a prescription, please? Hello. Hello.
Hello. How are you doing?
Oh, not doing very well at all. Really, I'm getting out of breath. It all seemed to have happened in the last month, really.
Just getting worse.
I'm not sleeping well. And in fact, Saturday night, I just couldn't breathe.
Have you seen the surgeons yet?
Well, they said my ventricle in the heart was closing up slowly, and that was why they said I should go see about having something put in to widen it up again. And I assume that's causing all the shortness of breath suddenly, is it?
Yeah. Well, if they do surgery, they will probably try to do it as minimally invasive as possible. So they might do it by going in via the wrist or via the groin and trying to open up the valve that way.
Yeah. I mean, if I was going to go, fine.
Yeah.
But if I'm going to find I'm worse off,
Yeah.
you know.
There are some risks of people having a stroke and things like that during this type of procedure.
Yes.
The worst case would be that you didn't make it through.
Yeah.
But I think if you do nothing, I think your symptoms are steadily becoming quite a lot worse, aren't they?
I felt I needed to make him aware that, you know, his illness is a life-threatening condition, and the natural process of that condition will be that he will steadily deteriorate and eventually die, albeit in an unpredictable time frame.
What do you think? If I didn't have it done, probably what? I've got about a year?
I think that's notoriously such a difficult thing to be able to predict, I think.
Yeah. I mean, my main thing is not so much going, but I don't want to find I'm going to spend months almost like a vegetable.
Doctors most certainly should not always intervene to save a patient's life through treatment. It completely depends on the individual situation and the individual patient, of course. In medicine, we always try to do good and not do harm. And so in some cases, intervention can cause more harm than good. And if they choose to decline a treatment, then you have to respect their wishes and respect that that's their choice.
I think we just need to really await this appointment with the cardiothoracic surgeon.
Yeah, and if anything, obviously it suddenly gets worse, I suppose.
If if things become, very critical and that overnight, then, 111, or if you feel it's a real dire emergency, then 999.
Yeah.
Okay.
Yes. Okay. Nothing I can do about it, is there?
When the time comes, whether I will have intervention or not, I think it is it very much depends on the situation, and I think until that time comes, I can't probably easily predict my decision, but within reason, I'm sure I would mostly want something done, if at all possible.
All right.
Okay. Thanks for your help.
You're welcome. Take care.
What can we do for you?
Okay, very simple. I have a hemorrhoid, and it's excruciatingly painful. Yes. Yesterday had some spots of blood on toilet tissue.
Okay, you've had these before, presumably, or
many years ago.
Right.
Yeah.
And you're fit and well otherwise?
Yes.
Should we have a look?
You can. Yeah, I've had a shower.
Fine.
I'm going to Italy next week, and I just thought, please go.
Yeah.
Just go before I go to Italy.
Oh, yeah, okay. I'm just going to... Just tell me to stop if it's too tender. I'm just going to put a finger inside. That is a nasty pick. It doesn't actually look like it's thrombosed yet, which is what happens sometimes.
Right.
When they get sort of clotted and then they become sort of almost permanent. Right, you get yourself dressed and we'll decide what to do. Now, when are you going away?
Tuesday.
There is a sort of rapid access, or sort of piles clinic, for want of a better word, that runs at St George's, but it's on a Thursday, as far as I remember.
I'll be gone.
Be gone.
Yeah. Yeah, I'm going to, we're going to southern Italy, Bari, do you know it?
I don't know. Sounds nice though.
And whilst we're there, I'm proposing, so we shall see.
So you really want these under control, don't you? Is it all planned then? Have you got a?
Yeah, bought the ring. I thought I'd just go for a nice stroll across the beach and then just go down on one knee as the sun's coming down and see if it all goes well. And if it doesn't, she's going in the sea.
Okay, so I think the thing to do really at this point is to treat it as much as you can.
Okay.
Now, it's on the sort of anal verge, so it's partly in, partly out, and as far as I can examine, there was a suggestion of some little ones slightly higher up as well.
Right.
So what I will give you is some suppositories.
Yep.
And some ointment as well.
Okay. So what do I do with the suppositories? Just push them off? Delightful. Right, okay.
All right.
Yep, thank
well,
you.
I hope it settles down.
Okay,
all right.
Okay.
Bye now.
Have a good day.
And you.
There was this
Can't be
woman
bothered.
came in and she wanted to register her unborn child. And I was like, well, if it's not actually like on the earth yet, I can't like register it. And I was like, wait till it comes, you know?
Come in. Come and have a seat. Okay. So you've had a rough few days, haven't you?
Yeah.
What does the pain feel like to you?
As if I've been beaten.
Really?
What about when you lay down? You can't lay down.
I can't
'cause
lay
of the
down on
pain.
my back. I can't put my back down.
Do you want to take your jacket off?
Yeah.
And if I press... Oh,
yeah.
It's sore, isn't it? Oh, it's sore all along there, isn't it?
Oh, yeah, it's bad.
Goodness me. Do you want to lie down? You can show me where it hurts. Might be useful. Because obviously we know you've got osteoporosis and your back is curved. I mean, sometimes you can get little fractures in the spine. Where's that hurting you?
Oh, right across there.
That.
Oh.
Where's that sore?
All across there. See, I've only got to move. I can't go on my back.
No.
Because of it, but it's hurting
so
across
difficult.
here.
Pain at the front.
Yeah.
It's difficult for me sleeping and everything. Oh, and then it's agony.
There's obviously pain in the chest there, which looks like it's coming from the muscles and the bones rather than coming from the lungs. Well, it's difficult to know. I mean, you can get an inflammation of the cartilages there called costochondritis. It's like an inflammation of the costal cartilages, basically. Come on, you sit up, make yourself comfy.
See, I haven't got any movement like that. I'm in agony all the time. I went to the hospital, but I mean, they weren't particularly bothered.
They were bothered, Mum. That's why they gave you the painkillers and the antibiotics.
But you've no idea the pain I'm in.
We do.
I can see.
It's all so depressing. Oh. See, it's only that I sort of pulled myself up then.
And it gets you. There is always the possibility of, Queen Mary's Hospital has Bryson White ward, which is like a rehabilitation type ward. If we're finding it difficult to manage the pain at home, I mean.
What about calling it respite?
I mean, is it something that you would consider?
Don't know.
You're in pain, Mum.
I don't want to go in hospital.
But it's not like going into an acute hospital.
No,
It's it's like
know
it's
what
more of
you
like a
mean.
rehabilitation type unit.
Mrs. Emanuel I've known for a long time, and she is a fiercely independent lady. She always comes in looking immaculately dressed. Her house is immaculate, and I think she's very proud of that and wants to be at home for as long as possible. But things had really come to a crisis point because unfortunately she's recently been diagnosed with Alzheimer's disease, and we weren't sure whether she was remembering to take her painkillers. I guess the benefit of going somewhere like Bryson White would be that we could hopefully get you better quicker.
Yes.
Should I make some enquiries anyway?
Make some inquiries.
Yeah?
I don't really want to. I want to stay in my own home.
But, Mum, you need assistance. You do need some
Need some
help.
help.
At the moment, you need some help.
I mean, I think if I was in Mrs. Emanuel's position, I, like her, would probably be the same. I mean, no one wants to lose their sense of independence and autonomy, and to feel that other people are making decisions for you. I'm not saying it's going to be forever.
No.
So leave it with me. Am I able to get you on the phone later, John?
Yes,
Yeah.
you've got my number.
Yeah, I've got your number. All right. All right, do you want a hand?
Any movement.
You got it. There we go. Okay. See you later. Okay, see you later. I'm really proud to be part of the NHS. It's the largest publicly funded health service in the world. And it means that everybody, regardless of wealth and income, has access to good health care.
Gracias.
Thank you. Bye. Bye.
People often ask me, well, what is it to be British? And I think the NHS is a fundamental part of what it is to be British, and something that I'm very proud of, and I think we should all be proud of.
That's all right, we'll find you on the system.
How can I help?
I've developed a rash.
Right.
Pretty much all over my body.
Right.
So this happened on Monday night, was the first time I noticed it.
Okay.
I'll let you look at it, but
Yeah.
it looks a bit like chicken pox.
Okay.
But it's not chicken pox, I'm pretty sure, because I've
Mm.
had that.
Right.
But it's very much like...
So let's just have a look. So it's quite flat to the skin, but it's not itching.
Yeah, it's not itching.
And did it all just come up, or did you
Yeah.
start with one spot?
No, it all came up.
It all just came up, and it's not itching you at all.
The first time I spotted it was Monday night when I was going to bed. So I've been taking antihistamines for a couple of days.
That's not
it's
helped
got neither
at all.
worse nor better. It's
No,
just,
and also, so if it was allergy, you'd expect A, it would improve with antihistamines, or B, it would be very itchy, but it's not
Yeah.
itchy. Infection-wise, you don't have a fever, you feel well, you've not had a sore throat recently,
No.
or any infection like that at all. I might see if I can pick the brains of Dr. Mackenzie next door,
Sure,
who's our
yeah.
skin guy.
Yeah.
Do you mind if I just quickly see if he's
Absolutely.
around? I won't be a second. Can I just really quickly pick your brains?
Excuse me for that.
Right, so there's a gentleman here with this is Dr. Mackenzie,
Hello there. Hi.
with a 5-day history of a rash. Started on Monday. It's not been itchy in any way. It's not responded to any antihistamines at all. And you're not on any medications?
No.
No.
Didn't start as one batch.
I thought I asked that.
Monday night, took my clothes off to get ready for bed, and I was covered in it.
Right. You know, they're all
see.
sort of leaf-shaped.
Yeah.
One has to ask the question, no risky behaviours?
Absolutely not.
Good. There you go. Adults with a rash, you got to think of that.
Yeah. He's been well in himself. He hasn't had a fever, no preceding sore throat or anything like that.
I reckon that's pityriasis rosea.
Yeah.
That's a classic sort of sign there.
What, they're scaling?
Yeah, the sort of scaling. I reckon that's what it is. So it normally take 10 to 12 weeks before it's sort of completely gone.
Okay.
You know, no creams will really make it better. Okay.
Brilliant, thank you. Okay, you want me to print you off a little information leaflet?
Yeah, that'd be helpful, yeah.
Yeah, the rash, there's a nice photo of it here. That's probably
That looks very similar.
quite similar, isn't it? Not contagious, so won't spread to other people.
And so just expect it to kind of disappear over the next number of weeks.
Yeah, 2 to 10 weeks, but can last as long as 5 months. But hopefully it will be sooner than that.
Don't plan to go on any beaches between them.
No, just cover it over.
I swallow. Do you know how many
put
tablets?
a note in your car?
13 a day.
Really?
And it's driving me potty.
Oh, that's a lot, isn't it? Yeah.
My cat licks me because it's salt and it makes his fur soft.
Oh, really?
He's a Persian.
I think once I go to just having to do the Wednesday one, it's fine.
It'll be all right.
Yeah.
Come in.
Hi.
Hi. Charlotte, is that right? Hi, I'm Dr. Rose.
Nice to meet you.
Hi. This is Laura. She's a healthcare assistant who gives us a hand. So...
Time for the coil.
Be looking forward to it.
Dreading it. Yeah, I know it hurts.
Because you've had it done before, haven't you?
Yeah.
You're keen to do the same thing again.
Yeah, although it hurts for the first, I found for 2 weeks afterwards, then for 5 years it's absolutely fine, so it seems like the best option of a lot of them.
So this is the coil that we're fitting, so this is what it sort of looks like. Basically what we do is I'll use the speculum, which is the thing that opens up your vagina so we can see your cervix, and then what I'll do is I'll remove the coil that's there at the moment.
Okay.
We have to go through the things that can go wrong. It's very unusual that anything does, but we just need to explain what can happen. No contraception is 100%. There's a tiny risk of pregnancy. If you were to get pregnant, then the pregnancy is more likely to be in the tubes rather than in the womb.
Someone told me their friend was born with, their friend's baby was born with a coil on their head.
Yeah, it does happen.
I've heard of
The worst thing that can happen to me as a doctor during a coil procedure is if somebody faints. This isn't uncommon because when we're fitting the coil, we stimulate a nerve, which makes it more likely for patients to faint. Because we can't see into the womb, there's a small risk of passing the coil through the wall of the womb. Sorry, I know this is the worst thing to tell people, isn't it? Just before we're doing it, but we sort of have to explain what the possibility. This
Have
is
you
never
done that before?
Never, never. So does that all make sense?
Yeah.
Yeah. You happy to sign your?
I am. My womb away.
Your womb away.
It's okay. Hello. Registered baby?
Yeah, we just called. He should see a doctor. He's sick.
I've got it. All right. Go up to the 3rd floor if you want.
Nice to meet you. Alice, come on through. Grab a seat. Grab a seat. Right. How can I help?
Misha is now 11 days and totally healthy from day one, gained weight from day one on. So, but this afternoon he started coughing and getting a bit weaker than he was usually.
Okay. How old is he? So he's 11 days old?
Yeah.
Okay. And is he breastfeeding or bottle feeding? And that's gone well?
Yes.
Feeding okay?
Yes. He never lost any weight even in the beginning.
And nappies, how are they?
He shits maybe 10 times a day, but he's gaining weight and he's healthy.
But the cough is what concerns you?
Yeah, and usually he's just totally boisterous and strong. And now he's like...
Should we have a look? Is that okay? Can you unpop him?
Yes.
And just roll just up. And can I come this side and you stay at the head ends? That'd be perfect. Okay.
We thought he has a slight temperature, nothing big, but...
Okay. Let me have a listen before he starts crying. Because it's not... Okay, buddy, let's have a listen. Oh. I know, I'm sorry. It's all cold and horrid, isn't he?
This mucus is like something related to a cold?
Just bear with me 1 second. Let me just have a good listen.
You all right?
Come on, ladies, I can do this.
You'll be fine.
Come on, Mr. Coil.
You all right?
Yeah, sorry.
It's all right, no. It would be funny if you weren't.
Yeah, I know.
So this is the speculum going in, okay?
It's like a smear test, this bit, isn't it?
Yes, yeah. So it just feels a bit cold.
Yeah.
You're doing really well.
Okay.
Sorry, do you mind if I hold you?
No, of course you can.
Are you all right?
Yeah.
You'll be fine.
You okay?
Yeah.
So we're going to take the coil out, okay?
Is it a nice big cough for me?
Cough.
Okay.
We go.
Is it out?
Yeah,
Yep.
that's out. You all right?
Hurts quite a lot, sorry.
Okay. Is it easing off? It's not what it was like when you got that sharp?
It's still quite sharp, but it's not as bad. It's kind of coming in a wave now.
Yeah.
It's still there. Is that normal?
Yeah. So this is the coil going in now, okay?
You all right?
Is it in?
Yep.
You've done really well.
I know I haven't.
You have. You've done amazingly.
I was practically crying. I think that's amazing.
I think it was the thought of it.
Hooray, 5 years.
Yeah.
You don't have to worry about it.
Thank
Sit
you for
there
holding
for a
my hand.
moment. That's all right. That's what I'm here for.
Do you feel all right?
Yeah.
The whole going into the knife sort of thing.
Yeah.
I couldn't
Like
do it.
people who want cosmetic surgery, like who are willing to put themselves like.
Yeah, just needle me, just chop me open. I don't care. There's no point. It's like my boobs are good as they are.
It's exciting.
So he's a bit congested as well, isn't he?
Yeah.
When he's just breathing like this.
That has been for now 1.5 days.
Has it? Okay.
2 days, something.
Okay, young man. Let's get you up. Are you okay to give him cuddle him over your shoulder?
Yeah, of course.
And I'll just have a listen to his back as well while he's nice and settled. Just nice and settled. Just have a listen.
Haven't lost all your strength.
Is Mum at home?
Yeah.
Okay. Just pop him down for a second again. Oh, no. Oh, okay. Why don't you pop his things back on and then we'll have a chat. He certainly sounds congested when you do listen to him. But actually, when you listen to his lungs, his lungs sound clear.
Good.
So there's no sign at the moment of any infection on his lungs, and his heart rate is not much higher than it should be for his age. So I think sometimes when you have a lot of mucus at this age, because everything isn't as developed, it's difficult to clear it. Yeah. I think some of the things that might help with that is that, so generally steamy environments, I think would be useful. Some moisture in the air.
We have a thing like that. We put it
around in the bedroom. Perfect. That will be useful. And you can get. I mean, there's very little at the moment for. Saline sprays, but you can get sprays for the nose that helps from the pharmacy that helps clear some of when it's very sticky.
They have that down here?
Yeah, downstairs we'll have that. So let's try the humidity. Let's see how this settles in the next few days. You need to keep a close eye because of his age. They can suddenly change, as you know. So if you find that actually you're struggling with feeding, the nappies are not as wet as they were.
Yeah.
Or he's still not as alert, or things are not improving. Or if you look at his chest and you see that his ribs, he's pulling in his ribs, or at the base of the throat, he's pulling it in when he's breathing, that's a sign that he's working too hard with his breathing. And that's a sign that you should get somebody to see him, even if it's in the middle of the night.
Thank you very much.
Not at all. You're right to get him seen, yeah.
Thank you so much.
No problem, he's nice and alert now. Okay. All right,
Bye-bye.
Take care now. Bye-bye.
He's had a viral infection. He was never that ill, but it tickled up his airways.
Hello. Who's this? Oh, hello.
Are you ready? Oh, good girl.
So you noticed those spots first yesterday, but there's a few more today.
Yeah, and they seem brighter.
Sometimes with skin rashes, it could be due to an allergy. Has anything changed at home? Any pets? No? Or any... Can't smell it yet. Can't smell it yet.
Meningitis is basically bleeding under the skin. So when you wipe a finger over it or put a glass on it, it doesn't disappear. Don't worry about any of that, okay?
Hi, how you doing? You alright?
Obviously number 8. I'm
Sorry.
I feel terrible. I've got a deaf in one ear for start.
Okay.
Which I don't know why. I'm getting a noise there all the time, and I can't hear a damn thing. It's driving me bonkers.
One thing that I was quite keen to do, remember last time you had that cyst?
Oh yeah, got
Just
that.
wanted to have a wee look at that if that's
Well,
all right.
the antibiotics seem to have worked, and it's got like a crust on now.
Yeah, I think we'll have to see what becomes of that really. That infection has settled down and that there's no real mole there anymore or anything.
If it was a mole, I must have caught it or something like that.
Well, should we just see how it goes? We'll keep an eye.
I'll keep it. Well, I mean,
keep an eye. We're going to be meeting anyway, aren't we?
Okay.
So we can just periodically review it. Okay.
Yeah, sure.
What else would you like to talk about today? Obviously, there's a lot going on, but
I would like to get a consultation with a drink specialist to get me off the booze because I am seriously concerned.
Yeah.
Because I'm getting home now. I'm depressed.
Yeah.
I'm not suicidal. Don't get me wrong, but I just start drinking, and I can't actually just say I'll have 2 and stop.
Yeah.
Once I've had 2, that's it. Boom. I don't know what the answer is.
Yeah.
I really don't. I know it's not doing me heart any good at all.
Yeah. It generally doesn't do you good to drink lots and lots.
Especially, I mean, I do appreciate it, but I've got no willpower. I try and try and try. It's very, very hard,
Yeah.
But I do want to stop drinking. I just detest it enormously.
Yeah. Dropped a line to that alcohol liaison.
You haven't heard from them yet?
I was hoping you might have heard from them.
Not a sausage, nothing. I'm being honest, I cannot stop. It's as simple as that.
Yeah. Okay. Alcohol services, I'm going to write to them.
Okay.
Do you want me to give you their number as well so that you can
You could do, if you wouldn't mind. Yeah.
So I'll find that for you in a sec. Okay.
Okay.
Do you want to catch up with me, in a couple of weeks?
Should I make an appointment or should I just give you a ring?
Talk on the phone if you want next time, save you a trip down.
Okay.
Yeah, and then we can see if there's anything that you feel you need to go see and I can stick you in for an appointment.
Fine.
All right.
Thanks very much.
No worries. Take care, all right.
I'll see what I can do about the
Yeah, all right. Look after yourself. All right. Cheers. I referred him to drug and alcohol services quite some time ago now, and he was transferred to your team because he fell out of area, full stop. He's really desperate to cut down his drinking, and I would appreciate any support you could provide as soon as possible, full stop. Thank you for taking the time to see him, full stop.
Three people queuing and just me, Carol and you picking up. Good afternoon.
It's okay, it's one each.
Putney Mead, how can I help?
Putney Mead, good morning, Nicola speaking.
Susan Watts, please. Thank you. Come through. So, welcome. I haven't met you before and think you were booked in to have a health check. Is that right?
Yes. Can I just give you the history? Then it sort of makes sense of it.
Yeah.
I use my stress by using adrenaline. So I'm on overdrive the whole time. And my father shook, and when I do that, I don't shake.
Yeah.
But to eat a bowl of soup, it's impossible. And last weekend, could I stop my shakes? They're the worst they'd ever be. So I think it's a hereditary pattern.
Yes, it can
rather
be.
than it being dementia or anything. And
Yeah.
I think I'm just so stressed I can't walk in a straight line. Signing my name now, you would have thought it was a spider on the website.
Okay.
So probably because I don't want to go down the Parkinson's line, dementia line, I now put in a program of exercising myself and walking much better. And I can't say in 3 weeks it's made much difference. Makes sense?
It does make sense. It does make sense. But it's an unusual presentation, and
Really?
yeah. What are your concerns that you think these symptoms might be?
I am concerned in case it's, I'm pretending it's not Parkinson's, but then I read the paper today seeing everybody's encouraged to go to their doctors and doctors get £50 for it. Oh, God, I've got years in the Times.
£55.
So I'm very conscious. I put myself in a category that really I might not need to be there. I just need to relax.
Well, I think you've done the right thing, so you're not just living with it. Susan's a psychologist herself and is very aware of anxiety and stress, and she very much, I felt, wanted me to diagnose that was the cause of the tremor. I just felt I couldn't minimise the symptoms as she wished me to. Okay, so let's do some coordination test. It's one of the ones that we ask patients to do, is just put your hands straight out in front of you. So
I'm very good at that.
Yeah. And now open your fingers. Can you close a bit?
I mentioned that
How do I get back to mine?
the car was stuck in. In M&S, and he said, yeah, he said there was one yesterday as well.
And then you do that with sync.
He's in 9, he's in a different room now.
Oh, is he? No, we were in 9 yesterday.
We weren't in 12, wasn't yesterday.
Nice to see you. Come on in.
Do you live anywhere near Kingston?
Do I live anywhere near Kingston? No. Why is that?
Oh, in 2 days, 2 people have jumped off the roof of M&S. In 2 different parts of the store, and our car is trapped there now until tomorrow.
Because you couldn't leave because someone...
Because they jumped off the car park.
Is that
today.
right?
Yes.
Gosh, that's very sad, isn't it? How are you doing?
I'm fine. I'm fine. The blood part of the urine disappeared after 1 tablet.
Did it?
Yes.
Okay.
I still took all 6.
Great. So no more bleeding in the urine?
No.
Any more clots?
No.
Nothing like that?
No.
You were going to see the urologist,
Yes.
is that right? Had you seen the urologist?
Yes, so did you want to see us today to report
how things
to you
gone?
how it
Yeah.
all went? Certainly. They reckon they'll get something to you within 48 hours.
Okay.
But hot off the press, you can have it from us.
What did they say today?
I've got stage 1
Okay.
bladder cancer of an aggressive type. When they biopsied all the crap they'd taken out, they found that the cells were would have been of an aggressive nature.
Right.
No evidence of it in the muscle wall.
Great.
And that's it, really. I'm very lucky, primarily because of you insisting on these constant samples and then taking it that bit further.
When you do pick up a cancer, it's very rewarding because it can have a big impact. It has a huge impact on people's lives, and most bladder cancers, thankfully, are picked up very early, before they've had a chance to spread into the lining of the bladder. And therefore, the prognosis for most bladder cancers, thankfully, is very good.
And how are you feeling about all of this? I mean, it's all kind of new stuff, isn't it?
Wonderful. It's whatever it takes.
Whatever it takes, yeah.
Whatever, and I don't feel at all bad. I feel absolutely wonderful that I've got it, because I know I've got it.
In fact, you know you can do something about it.
Yeah, right.
And nothing else is involved. And I
No.
think that's the important
She
bit.
did mention the surgeon, who's a lovely lady, that bladder cancer rarely extends beyond the bladder.
This gentleman is an incredibly positive and determined gentleman. But in a consultation, I think I'm doing 2 things in my mind. One being present in the room and listening to what's being said, but also being curious about what I'm not hearing from someone who's dealing with cancer, and why I might not be hearing that. And that's as important for me.
Okay, good. So you're feeling positive about it?
I don't think I've ever felt particularly negative.
No. Great.
You've not noticed, have you?
No.
Have you?
Well, a couple of times you've been a bit wobbly.
Well, when I made a reservation at Dignitas, I suppose you could call that slightly negative. But they said they didn't have any vacancies that Tuesday.
Will you do it when you stand in front of me? Put your fingers out, extend your arms and open your fingers a bit. And now could you close your eyes? Okay, I'm going to push the hands down and I want you to bring them back to the place that they're at. Now this time I want you to move between your nose and the tip of my finger as quick as you can. Good. Oh. Good. I want you to try and do that as quickly as you can. Quick, 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 quick. And the other side. That one's harder.
Much harder.
Yeah. Now try to do the walking and the balance, okay? So one of the simple ones is just toe heel, okay? Well done, good effort. Okay, so if you could just write that underneath, that would be great, thank you.
Far slower than I used to write.
Really, yeah, yeah. And this arm was tremoring as well.
Oh, was it?
It was when your hand.
Can you tell more than that than the other things you've been looking at?
I think that did give me an indication of probably how difficult it is, being such a capable lady, to then have to work so hard at doing something like that. I was also slightly concerned about your toe walking.
Yeah.
That would make you quite at risk of falling as well as you get older. And it's fantastic that you're doing exercise, and we should really continue because that's going to help your balance. But you would be more vulnerable for falling as you got older.
I'm very conscious of walking now. I'm trying to keep a straight line.
Yeah. I think I should refer you to see a neurologist.
Right.
I can't diagnose anything just straight off.
Okay, neurologist here I come.
Neurologist, here you go. I'm so glad you've come.
Lovely.
Thank you.
I know, thank you.
You've been so candid.
I don't know how
and
you
open.
manage it, to give this amount of energy out to each patient. Just don't know how you do it.
Well,
I hope tomorrow's a rest day.
It makes it a more enjoyable job.
For some reason, I'm covered in a burning rash.
Right, well, you're a little bit of a mystery.
I have a hot shower and it goes away.
It's weird, isn't it?
You lost 2.5 kilos in 4 days.
Yeah, that's a mystery.
I keep getting these blood blisters.
I mean, these are puzzling, I must say.
Sometimes in medicine we can't say what specifically something is, but I can tell you what it isn't.
What can I do for you?
I have a mobility issue in my right hand.
Okay.
I'm an office worker. Typing is becoming incredibly difficult, really quite painful. It's kind of something which has evolved over the last 6 months. Keeping it really simple, left hand.
Yeah.
That's it fine. Right hand is just have very limited mobility in it.
Okay. And what's the origin of that?
I don't know.
Okay.
I'm typically male, typically late about coming to doctors, all of those things.
Are you left or right-handed?
Left-handed for writing, but like right-handed for sport.
Okay.
The thing I'm wondering is I've learned golf this year. Don't know.
You have enough dexterity to do that, so to grip the club, but
I just noticed pain
typing.
Occasionally.
Do buttons up and stuff?
Doing my cuff is a lot harder.
Yeah.
But I can do it.
Have you noticed it with anything else? Tying your shoelaces?
No, shoelaces is fine.
Would you mind just tying your shoelaces for me? Or untying
It
them?
won't be a problem at all.
I'm just looking at you using that right hand, because that command, from your brain seemed to be automatic and seemed to work fine, didn't it? Do this again, so like you're playing a piano. Do you play the piano by any chance?
I used to a little bit when I was younger, but the left hand's 100%.
Yeah.
And I could do that all day long.
And you can't do that at all with that hand?
So I'm commanding my hand. It's very tiring. I'm going, come on hand. It's mentally exhausting even just to do that.
Yeah.
I'm really saying, come on.
Yeah. So, for example, do this. So the elbow, shoulder, you can swing around.
I mean, I've got 2 kids. I can load up.
So
weight.
it's just the fingers, literally.
It feels
what
the
about,
fingers and the wrist.
So do your wrists for me. And round and round. Round with that one.
I'm trying.
So wrist and hand. If I touch your hands, does that feel the same?
Doesn't feel any. Without being extreme, doesn't feel like I've had a stroke or paralysis, anything like that at all.
And so the sensation to you feels the same. You're not noting no pins and needles, nothing like that.
No, never at all. I would have come. Absolutely would have.
And but you can't.
I can command it, but I just can't translate it.
I think it's quite common in general practice for a patient to come and to have something that it's very hard to put a name on and to diagnose as something. I think whilst medicine is partly scientific, there's also a lot of art to it as well, if you like, and it's some of what we do is almost trial and error.
What I am going to do is ask for advice. We've got a kind of email advice line. What we need to do is get some sort of imaging or study on that. We can do a nerve conduction, and I just want to check if that's the right thing to do or if it's some other sort of test. So what I'll do is I'll get some advice and then I'll let you know. So I basically, I don't want to send you down the wrong route.
Yeah, no, it's a tough one.
But you've absolutely done right in coming to see us, and we need to look into it and find out what's going on.
Patients seem to appreciate it if you admit to your, lack of supreme knowledge almost and say, I actually don't know what's going on here. We're human at the end of the day, and we don't know everything, and as long as we're honest about that and admit that, I think they, on the whole, don't seem to have a problem with it, and I don't either, really, I don't think.
I shall get back to you in either tomorrow or Monday.
Cool.
Is that all right?
That's lovely. Really appreciate your time.
Okay.
Thank you very much.
No,
Take
good
care.
to see you. All right. Bye. Yeah, I was about to say. It's a good, strong handshake, so. All right. Bye.
I've got 40 tasks.
40. I've got none.
All right, rub it in, why don't you?
40 tasks. I haven't. I've got none from today.
I've got one. You heard one. It's because I don't delete them. That's how bad I am.
I actually have the patient to come in for.
Come in.
Good afternoon.
Hello, hi, is that Alexander, is that right?
Yeah. Basically, about a week ago or so, completely out of the blue, in the middle of the night, I woke up to a really bad chest pain, right down the centre bone.
Right.
Nothing else really associated with it, no difficulty breathing, nothing that was going to cause me concern or think I should rush into hospital. So I put some deep heat on it, and then since then the pain's just been fluctuating. I get a heartburny kind of sensation as well quite a lot of the time.
Is that before the pain came on?
During the pain,
During the
actually,
pain,
to be honest.
okay.
And so it comes in waves, and today and yesterday it's kind of become a little bit more consistent or continuous, I should say.
Right,
Because it's making me feel a little bit groggy as well, to be honest.
Yeah, and what had you been doing that day or the day before, can you remember?
I've been going to the gym, and I have been going to the gym probably with more intensity or regularity than I would normally in the last couple of months. I've certainly stepped it up a bit.
Have you been feeling short of breath at any point at all?
It's not so much a shortness of breath as it feels like quite a laboured breathing.
Would it be okay if I had a look?
Yeah,
That's
absolutely,
okay.
of course it is, yeah.
And what do you do work-wise, if you don't mind me asking?
I'm an airline pilot.
An airline pilot?
Yes.
Oh, okay. And have you been on any long-haul flights or anything like that?
Yeah, I mean, I've been flying fair distances, but nothing outrageously far.
So in the last week, or?
Oh yeah, I've been flying.
Oh, okay.
I've been flying most of the week, in fairness.
Is it affecting work?
It's not affecting my work. It's just one of those things that it fluctuates, but it never affects my levels of concentration and whatever.
Fair enough. It's just the kind of niggly thing that's there and comes on and
goes,
lingers a bit. So if I push on it,
Yeah.
can you just tell me if it hurts you at all?
Yeah, that's tender.
That's tender. That caught you. Sorry, I don't mean
It's
to
all right,
make you
that's
jump off bed. What about on the other
actual
side?
Chest itself, no,
Yeah,
it's not
chest
too
wall
bad.
itself.
It's not too bad there.
I'll let you put your
Yeah,
shirt on. Do you mind just putting your t-shirt on, not the jumper? Just going to do your blood pressure, and then I'll go through what I think is going on. If it'll make a bit more sense.
Yeah, it's fine. I'll try and relax the arm.
Yeah, absolutely. Relax as much as you can. Okay. The upper value is ever so slightly on the higher side.
Okay.
It might be because I've been pushing on your chest and caused you a bit of pain.
Yeah, maybe,
just
I don't
now.
know.
Doesn't strike me as a heart problem in any way, because heart problems tends to feel a bit different, more of a kind of tightness, pressure sensation
Yeah,
that's
it's
worse when you're
certainly
doing
not that.
things. And I think you've got an inflammation of the bone here.
Okay.
But the fact that when you push on it, it's quite tender. It suggests there's something quite local around that area.
Okay.
I think this is almost certainly because of the gym work. The treatment for it is anti-inflammatory medications. So I don't know if you're okay.
Ibuprofens, maybe?
Yeah, exactly. Ibuprofen, okay.
No, thank you for your help.
And I think flying's okay.
Good. If you think it's okay.
No, I think it's okay.
Funnily
In
enough,
case there was
I've got
any doubt.
days off now, actually,
Fair
so I'm not in for a while. So I'll give it a rest now for a few days, and fingers crossed it'll work.
Hi there.
Is Dr. King on the third floor?
Yes, he is. He's on the third floor.
I was just about to get there. Is your name Brian?
Yeah.
Yeah, I'll sign you in.
Hi.
Morning.
Is it Margaret Kutil, yeah. I'm Dr. Bavadia, nice to meet you. Oh, is that just your...
Listen, I think I've got scabies. I get these frightful attacks of scratching. I mean, it began here and I managed to stop.
Yeah.
I get them on my hands. This was last week, there's the signs.
Right.
I'm also a doctor, epidemiologist, and it just looks to me like scabies. And I bought some stuff, actually, and then somebody told me there's a better stuff called ivermectin, which you can take as a pill. Can I show you a place on my...
Yeah, please do.
Okay. I just want to show you where... Sorry.
Yeah, of course.
This was one about 3 or 4 days ago.
Yeah,
I scratched. I just couldn't think of anything else it could be. I've had it here.
Right.
There's not much old.
Is there anything else to see?
No.
No, okay. You've had an itchy rash that comes and goes.
Yes.
I've got no information on you. Are you normally fit and well?
Well, I've got cancer of the lung.
Right.
That's been done by stereotopic body radiation, SBRT, about half a year ago. And I had a myocardial infarction 7 years ago.
Okay.
My blood pressure's low, not high. Otherwise, I'm well.
Do you take any regular medication?
I've got some arthritis in my hip, so I take diacerin or something.
Doctors sometimes can be incredibly resilient and feel that because they have some, a lot of medical knowledge and experience, that they just deal with their symptoms. They might try and soldier on.
Where are you normally registered?
Israel.
Okay.
I'm here visiting my sister.
Okay, and you're an epidemiologist? What, like a doctor, like a public health?
Yes.
Okay, all right. And how are things in Israel, all right?
Ghastly. I may have picked it up in Israel. God knows, after this war, all the soldiers coming back. But I don't know. I mean, I didn't have anything there.
A difficult one. It doesn't look like classical scabies, but as you know, scabies is the thing that mimics many forms. I haven't heard of the tablet that you mentioned.
Well, I'll tell you how to spell it.
Ivermectin is not recommended.
Really?
Yeah.
Has it got contraindications?
It's on a named person basis only available and has been used in combination with topical treatments. So I think perhaps you're better just using the permethrin.
Which is the antihistamine one?
Cetirizine.
Cetirizine.
All right.
The tablets.
Yeah.
That's for the whole body. You don't have an ointment instead. I mean, I don't need to take something when I've just got an itch on my hand.
It'd be better with that, probably.
Yeah?
Yeah.
I have in the past treated doctors who have felt that we should be doing one thing for them, and I felt that we should be going down another line.
It's like taking things. More, I mean, I have to, but...
Yeah, try it. It's tolerated pretty well by people.
Okay.
All right, take care. Bye now.
Why do doctors go to the doctor?
That's true. If you're a doctor and your friends are doctors, they can just prescribe anything for you.
Give you drugs.
Yeah.
Sorry, it's not ideal for you, is it? What can we do for you?
I'm going to see my family in South Africa next week.
Okay.
Which is quite traumatic as it is. But I'm going to run out of pregabalin whilst I'm there, and I just wondered whether I could get some more pregabalin.
Is pain a significant problem then? Have we been sort of playing with things to try and get it manageable, or is it manageable at the moment?
It's not manageable because it's there all the time. So I guess we're having a sort of intensive period of trying to get this tilt assessed more. And then also try to take me off some of my morphine because I'm quite heavily addicted to it.
Yeah. Okay. Perhaps not the time to start changing things now anyway, but I wonder have you flown before taking these medications with you?
Yeah.
Sometimes people like a letter for those sorts of medications, which I'd be happy to, but you've never run into problems.
Yeah, I've got a prescription.
Yeah.
Thank you very much.
Anything else we can do for you?
Thank you.
Okay. Again, free. Cheerio.
How are you doing?
Yeah, the tablets are a lot better now. Thank God.
Great. Are they? Are they?
Really, really well.
Come sit,
Yeah.
Mummy, come here.
And I'm actually waking up in the mornings feeling like I've had a sleep.
Great.
I'm so happy with it. I'm so happy. Yeah, I feel a lot better. And for the
When
little
are
while.
you going?
I'm going to Ireland in 3 weeks, and then we're going the week after. So yeah.
And where are you going to be staying?
My sisters.
No, in New York.
Oh, New York. Oh, sorry. We're actually staying in a hotel just off Central Park.
It's a beautiful time as well.
It's lovely. I love it. Yeah. I love it. Yeah. And it's not. I don't like going away.
Do you feel frightened to go
I'm a little bit nervous because I am worrying, is something going to happen to tumour up in the air, you know?
There is a risk flying. It's different for every patient and at every stage of the illness, and actually for where in the brain the tumour is. It's to do with the pressure of the oxygen in the cabin.
The thing about it is I could be here, I could be walking down the road and something had happened, so it's one of them things, you know what I mean?
Before you go, I think I'd quite like to give you a letter as well to take with you, give a medical history just in case.
Please, God, but if anything happens.
Yeah, I think what was going through my mind through the consultation was I can't make Fidelma better. But I think it was just so important a trip for her to make. It was very symbolic. She'd been given this as a 50th birthday present at the beginning of the year when she was totally ignorant that there was a brain tumour growing. Oh, I'm so pleased you're going.
Yeah, no,
I'm
really
so pleased.
No, they've all been given out to me. My mum, she's
Of course they
go,
would.
Go.
Of course they would.
Do you want to give Dr. Ham a high five?
Wow, that's stinging.
Come here, you've been
have a good time.
You've been so good to me, so you have. Really, really good.
Have a good time.
Yeah, I will. And you,
Have a good time.
I'll see you. And if
Yep.
there's anything you want, let me know.
Yep.
I did
Yep.
tell you that.
You did tell me that. You did tell me that. Right, lovely to see you. Thank you. All right, bye. Bye. Oh, she's a nice lady.